Now from what is arguably just a shiny object, I guess you could argue that is, the Scaramucci story, to the story that has a far broader impact on Americans, Congress's failure to overhaul health care. Joining us now from Capitol Hill, Democratic Congressman Joe Kennedy III of Massachusetts. Congressman, where do we go from here? And also, what's the Democrats' role in this process? And what can they do to make their party great again?
So, first off, thanks for having me. Great to be with you again. Look, it was a big night. Last night it was a big night for the American public. It was a big night for our healthcare system. It was a big night for the commitment that we, I think as a country, make to each other to make sure that when people are vulnerable, when you are sick, when you are scared, that there is a system there that you can count on. Now, the bottom line on this is that for a lot of folks across the country, our healthcare system is not perfect. And while we've made tremendous gains under the Affordable Care Act, we need to continue to make sure that every person in the country has access to quality, affordable health care. That's got to be every single person's promise. And so where do we go from here? First off, it's making sure that this administration is not going to continue to try to sabotage the efforts to make that promise true. You saw the president tweet early this morning that he was going to try to make the law fail. That actually means that he's rooting for people to get hurt, for people to suffer, and for our economy to tank, which is stunning comments to hear from the President of the United States. Two, it is strengthening and stabilizing the individual market. Certainly we've seen premiums that are forecasted to go up and have gone up. But if you ask the insurers why, a lot of that is due to the uncertainty around what's going on in these buildings and what the administration's actually doing to try to strengthen our healthcare system. Third, it's actually diving into the substance of these challenges, particularly around prescription drug costs. And in my mind, a huge priority has to be a mental and behavioral health overhaul that is devastating families, is filling our criminal justice system, and particularly at a time when we're suffering from an opioid epidemic around the nation. Locking people up and throwing away the key isn't the way you solve that problem.
Harold.
Joe, Congressman Harold Ford, good morning. Tom Cole was just with us a few minutes ago, and he shared some of the principles and tenets that he would need to start a conversation with Democrats, because it's clear Obamacare has worked largely, but there are some challenges, particularly around premium increases and a dwindling of competition in markets across the country. So how do you address his two principal concerns? One, that Medicaid expansion is unsustainable from a dollar standpoint, and two, the lack of competition that exists in exchanges across the country. What would be the Democratic response to that to try to solve this problem?
So I think a couple of points on that one, Harold. So first off, Medicaid reimbursement rates, there's not a whole lot of doctors across this country that get rich off of Medicaid. One of the challenges that we have with Medicaid when it comes to access to care is that those reimbursement rates are in fact so low that many patients, even if you're on Medicaid, can't find a provider that will deliver health care to you, which is certainly the problem on the mental health side. And I'd point to, if you're looking to try to save dollars here, it actually means flushing out a continuum of care so that you're able to address people and find them before they end up being so costly on our system. That is certainly the case on mental and behavioral health. It's the biggest driver on Medicaid as well. There's a very small percentage of the population that ends up being the highest cost drivers to the overall system. And that's, I think, where we really need to focus. I would also point out that, look, in the long run, it's doubling down on what the Affordable Care Act, the system that actually put forth, which is this transition off of a volume-based or fee-for-service-based model of healthcare delivery to try to make sure that providers are compensated for the quality of the care that's actually delivered. The Affordable Care Act set up that structure. We need to make sure that we flush it out and fund it. And if you do that, you will get the savings that I think all of us know are in that system, and we're in the midst of that transition at the moment.
All right, Congressman Joe Kennedy, thank you very much.
Thanks so much, guys.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.